Botox Cosmetic Onabotulinum Toxin A. Important information. Indications. Botox Cosmetic Onabotulinum Toxin A is indicated in adult patients for the temporary improvement in the appearance of moderate to severe glabellar lines associated with corrugator and/or procerus muscle activity, moderate to severe lateral canthal lines associated with orbicularis oculi activity, moderate to severe forehead lines associated with frontalis activity. Important safety information, including boxed warning. Warning: distant spread of toxin effect. Post-marketing reports indicate that the effects of Botox Cosmetic and all botulinum toxin products may spread from the area of injection to produce symptoms consistent with botulinum toxin effects. These may include asthenia, generalized muscle weakness, diplopia, ptosis, dysphagia, dysphonia, dysarthria, urinary incontinence, and breathing difficulties. These symptoms have been reported hours to weeks after injection. Swallowing and breathing difficulties can be life-threatening, and there have been reports of death. The risk of symptoms is probably greatest in children treated for spasticity, but symptoms can also occur in adults treated for spasticity and other conditions, particularly in those patients who have an underlying condition that would predispose them to these symptoms. In unapproved uses and approved indications, cases of spread of effect have been reported at doses comparable to those used to treat cervical dystonia and spasticity, and at lower doses. Contraindications. Botox Cosmetic is contraindicated in the presence of infection at the proposed injection site or sites and in individuals with known hypersensitivity to any botulinum toxin preparation or to any of the components in the formulation. Please see additional important safety information at the end of this video. Botox Cosmetic Onabotulinum Toxin A is indicated to temporarily improve the appearance of moderate to severe forehead lines, lateral canthal lines, and glabellar lines in adults. Botox Cosmetic acts on motor neurons to temporarily reduce muscle activity in injected areas. The exact mechanism of action for Botox Cosmetic is unknown. The following illustrates how muscle contractions occur, and then how Botox Cosmetic helps to temporarily reduce the muscle contractions that cause facial lines to appear. Neurons send signals to the muscle cells, causing them to contract and produce movement. Over time, repetitive muscle movements may cause facial lines to form. The presynaptic neuromuscular motor nerve ending contains vesicles prepared to release the neurotransmitter acetylcholine. When neuronal stimulation occurs, the vesicle fuses with the nerve membrane. This process is facilitated by interaction between proteins on the vesicle and the cell surface, forming the snare complex. Binding of the vesicle to the membrane triggers acetylcholine release, which results in muscular contraction. This is the normal function of muscular contraction prior to Botox Cosmetic injection. Now, let's review the Botox Cosmetic mechanism of action. The Botox Cosmetic complex includes the 150 kilodalton core molecule surrounded by its protective accessory proteins. This is the 150 kilodalton core molecule. The Botox Cosmetic core molecule is comprised of a 100 kilodalton heavy chain and a 50 kilodalton light chain. The heavy chain contains the binding domain that allows it to interact with the receptor of the nerve terminal. Therefore, it is able to enter the cell through the process of endocytosis. The toxin, which is now contained within a vesicle inside the cell, releases the 50 kilodalton light chain into the cytoplasm. Once in the cytoplasm, the light chain is available to cleave SNAP25, one of the snare proteins involved in the formation of the snare complex. This prevents the release of acetylcholine. When acetylcholine cannot be released, muscle contraction cannot occur. When injected intramuscularly at therapeutic doses, Botox Cosmetic produces partial chemical denervation of the muscle, resulting in a localized reduction of muscle activity. Remember, only Botox Cosmetic is FDA approved for the temporary improvement in the appearance of 3 areas: moderate to severe forehead lines, lateral canthal lines, and glabellar lines in adults. Botox Cosmetic Onabotulinum Toxin A. Important information. Indications. Botox Cosmetic Onabotulinum Toxin A is indicated in adult patients for the temporary improvement in the appearance of moderate to severe glabellar lines associated with corrugator and/or procerus muscle activity, moderate to severe lateral canthal lines associated with orbicularis oculi activity, moderate to severe forehead lines associated with frontalis activity. Important safety information, including boxed warning. Warning: distant spread of toxin effect. Post-marketing reports indicate that the effects of Botox Cosmetic and all botulinum toxin products may spread from the area of injection to produce symptoms consistent with botulinum toxin effects. These may include asthenia, generalized muscle weakness, diplopia, ptosis, dysphagia, dysphonia, dysarthria, urinary incontinence, and breathing difficulties. These symptoms have been reported hours to weeks after injection. Swallowing and breathing difficulties can be life-threatening, and there have been reports of death. The risk of symptoms is probably greatest in children treated for spasticity, but symptoms can also occur in adults treated for spasticity and other conditions, particularly in those patients who have an underlying condition that would predispose them to these symptoms. In unapproved uses and approved indications, cases of spread of effect have been reported at doses comparable to those used to treat cervical dystonia and spasticity, and at lower doses. Contraindications. Botox Cosmetic is contraindicated in the presence of infection at the proposed injection site or sites and in individuals with known hypersensitivity to any botulinum toxin preparation or to any of the components in the formulation. Warnings and precautions. Lack of interchangeability between botulinum toxin products. The potency units of Botox Cosmetic are specific to the preparation and assay method utilized. They are not interchangeable with other preparations of botulinum toxin products, and therefore units of biological activity of Botox Cosmetic cannot be compared to nor converted into units of any other botulinum toxin products assessed with any other specific assay method. Spread of toxin effect. Please refer to boxed warning for distant spread of toxin effect. No definitive serious adverse event reports of distant spread of toxin effect associated with dermatologic use of Botox Cosmetic at the labeled dose of 20 units for glabellar lines, 24 units for lateral canthal lines, 40 units for forehead lines with glabellar lines, 44 units for simultaneous treatment of lateral canthal lines and glabellar lines, and 64 units for simultaneous treatment of lateral canthal lines, glabellar lines, and forehead lines have been reported. Patients or caregivers should be advised to seek immediate medical care if swallowing, speech, or respiratory disorders occur. Serious adverse reactions with unapproved use. Serious adverse reactions, including excessive weakness, dysphagia, and aspiration pneumonia, with some adverse reactions associated with fatal outcomes, have been reported in patients who received Botox injections for unapproved uses. In these cases, the adverse reactions were not necessarily related to distant spread of toxin, but may have resulted from the administration of Botox to the site of injection and/or adjacent structures. In several of the cases, patients had pre-existing dysphagia or other significant disabilities. There is insufficient information to identify factors associated with an increased risk for adverse reactions associated with the unapproved uses of Botox. The safety and effectiveness of Botox for unapproved uses have not been established. Hypersensitivity reactions. Serious and/or immediate hypersensitivity reactions have been reported. These reactions include anaphylaxis, serum sickness, urticaria, soft tissue edema, and dyspnea. If such reactions occur, further injection of Botox Cosmetic should be discontinued and appropriate medical therapy immediately instituted. One fatal case of anaphylaxis has been reported in which lidocaine was used as the diluent, and consequently, the causal agent cannot be reliably determined. Cardiovascular system. There have been reports following administration of Botox of adverse events involving the cardiovascular system, including arrhythmia and myocardial infarction, some with fatal outcomes. Some of these patients had risk factors including pre-existing cardiovascular disease. Use caution when administering to patients with pre-existing cardiovascular disease. Increased risk of clinically significant effects with pre-existing neuromuscular disorders. Individuals with peripheral motor neuropathic diseases, amyotrophic lateral sclerosis, or neuromuscular junction disorders, for example, myasthenia gravis or Lambert-Eaton syndrome, should be monitored when given botulinum toxin. Patients with neuromuscular disorders may be at increased risk of clinically significant effects, including generalized muscle weakness, diplopia, ptosis, dysphonia, dysarthria, severe dysphagia, and respiratory compromise from onabotulinum toxin A. See warnings and precautions. Dysphagia and breathing difficulties. Treatment with Botox and other botulinum toxin products can result in swallowing or breathing difficulties. Patients with pre-existing swallowing or breathing difficulties may be more susceptible to these complications. In most cases, this is a consequence of weakening of muscles in the area of injection that are involved in breathing or oropharyngeal muscles that control swallowing or breathing. See boxed warning. Pre-existing conditions at the injection site. Caution should be used when Botox cosmetic treatment is used in the presence of inflammation at the proposed injection site or sites, or when excessive weakness or atrophy is present in the target muscle or muscles. Dry eye in patients treated with Botox cosmetic. There have been reports of dry eye associated with Botox cosmetic injection in or near the orbicularis oculi muscle. If symptoms of dry eye, for example, eye irritation, photophobia, or visual changes, persist, consider referring patients to an ophthalmologist. Human albumin and transmission of viral diseases. This product contains albumin, a derivative of human blood. Based on effective donor screening and product manufacturing processes, it carries an extremely remote risk for transmission of viral diseases and variant Creutzfeldt-Jakob disease, VCJD. There is a theoretical risk for transmission of Creutzfeldt-Jakob disease, CJD, but if that risk actually exists, the risk of transmission would also be considered extremely remote. No cases of transmission of viral diseases, CJD or VCJD, have ever been identified for licensed albumin or albumin contained in other licensed products. Adverse reactions. The most frequently reported adverse reactions following injection of Botox cosmetic for glabellar lines were eyelid ptosis, 3%, facial pain, 1%, facial paresis, 1%, and muscular weakness, 1%. The most frequently reported adverse reaction following injection of Botox cosmetic for lateral canthal lines was eyelid edema, 1%. The most frequently reported adverse reactions following injection of Botox cosmetic for forehead lines with glabellar lines were headache, 9%, brow ptosis, 2%, and eyelid ptosis, 2%. Drug interactions. Co-administration of Botox cosmetic and aminoglycosides or other agents interfering with neuromuscular transmission, for example, curare-like compounds, should only be performed with caution as the effect of the toxin may be potentiated. Use of anticholinergic drugs after administration of Botox cosmetic may potentiate systemic anticholinergic effects. The effect of administering different botulinum neurotoxin products at the same time or within several months of each other is unknown. Excessive neuromuscular weakness may be exacerbated by administration of another botulinum toxin prior to the resolution of the effects of a previously administered botulinum toxin. Excessive weakness may also be exaggerated by administration of a muscle relaxant before or after administration of Botox cosmetic. Use in specific populations. There are no studies or adequate data from post-marketing surveillance on the developmental risk associated with use of Botox cosmetic in pregnant women. There are no data on the presence of Botox cosmetic in human or animal milk, the effects on the breastfed child, or the effects on milk production. Please see Botox cosmetic full prescribing information, including boxed warning and medication guide, or visit https://www.rxabv.com/pdf/Botox-cosmetic_PI.pdf.